Hi everyone, this is Dr. Sowmya Raghavan, consultant obstetrician from Apollo Cradle, Karapakkam. What does every pregnant woman want? She desires for a normal delivery. Similarly, what does the obstetrician want? She wants to give her patient a normal delivery. So, let us see how the patient and the doctor can work towards a normal delivery. The patient has to take advice from the doctor, follow the advice, and the doctor supports her throughout pregnancy. This way, the probability of having a normal delivery increases greatly. Except in unusual circumstances where there are predetermined conditions, most of the time we expect only a normal delivery. So let us see what helps us to achieve this. So first is knowledge about pregnancy and labor process. It is good to take antenatal classes or to clear your doubts with the obstetrician or the childbirth educator, because this knowledge will give you a great empowerment, so that you will be empowered to go through labor process comfortably. Also, you should be aware of what are the methods of pain relief which are available, like for instance epidural anesthesia, which is a catheter placed in the back, and through that the medication will be given. This helps the labor to proceed naturally but without any pain. If you do not want that, you have the option of having Entanox, which is a gas which when inhaled gives you pain relief. You have other methods, like if you don't want to go for anything artificial, you can have the deep breathing techniques which would help to calm you during labor. So knowledge is really important, so that you are able to understand the labor process. And secondly, it's also a good idea to go through the labor room, so that you are familiar with the surroundings and who is going to attend to your labor and delivery. That will make you feel very comfortable. The next thing is diet. Diet is very important, so that you are able to have a good stamina. Just the previous day, I think you should have say prior to your labor induction, I would advise you to eat properly, rest properly, because eating a healthy diet is very important even during your pregnancy and labor process. So during your pregnancy, the right amount of carbohydrates, proteins and your vitamins are important, because this would strengthen your body muscles, as well as the baby's health is depending on your nutrition. Apart from that, I would say probably you could go in for these, you should hydrate yourself very well, drink a lot of liquids. If you're not okay with drinking water, just take a lot of lime juice, which itself will give you nourishment. Apart from that, you can have this thin buttermilk, which is going to help you to hydrate yourself. So eating a healthy diet and drinking plenty of water goes a long way in helping you through labor. Next thing would be exercise. I would want you to exercise regularly throughout your pregnancy. So exercise means probably even brisk walks, 30 minutes every day would help. Apart from that, you have to go for these antenatal classes, meet your physiotherapist or childbirth instructor, who would advise you regarding the exercises. So what exercises are useful in pregnancy, or what would they suggest during pregnancy? They would ask you to do initially start off with the leg exercises, leg stretches, pelvic stretches, and then move on to squats. You could do the butterfly exercises, the squats using the Swiss ball. Supposing you're already exercising, they would also train you with a little bit of weights. Apart from that, even yoga is very good for you. It helps to calm your mind. It helps to regulate your breathing. Also, the pranayamas will make you feel that, you can increase the oxygen supply, so that baby is healthy inside. I would also like to talk about the Lamaze technique of breathing. This technique is very useful during labor. That is in between, or when the patient is in latent phase, that is the contractions are very mild. That time she could do the deep breathing exercises, where she would inhale deeply and then exhale slowly through the mouth. And then you have the other method where there is shallow breathing. Both the techniques would help to deliver maximum oxygen supply to the baby. So, supposing you are in early labor, the deep breathing technique will help you to hold oxygen and then you can slowly let it out. When you're in active labor, the fast breathing and fast exhalation, that is the fast inhalation and exhalation, could still help to deliver maximum oxygen to the baby. First, the fear and anxiety related to pregnancy should be taken care of. So for that, you should maintain a positive attitude. You should read books which make you relax, listen to good music. Apart from that, have a restful sleep, at least 8 hours of sleep in the night and 2 hours in the daytime if you're able to. Otherwise, at least you compensate it with your night sleep. And then the next thing is to surround yourself with friends and family who would be of help during your pregnancy, give you positive thoughts. They might, make you feel comfortable, and you can choose any of them, either a partner or your husband or your one of your family members to be with you during the labor process, because this would help you to go through labor process comfortably, because you don't feel that you're away from family. So that would give you a lot of support. So with all these tips, I'm sure you would go through pregnancy and labor successfully. So all the best for your pregnancy and labor journey. Happy motherhood. Thank you.